Good evening. Welcome to the Health, Hospitals, and Social Services Committee on Tuesday, September 21st. We do have a quorum. Councilman Hurd, Councilman Glover, Cooley, Councilman Walsh, Taylor. All right, thank you. So I'm going to go ahead and get started. We have a few items to take up, and I know one will have multiple discussions, so I'm going to get started now. Ours 2021-1155 by Toombs, Taylor, and others accepts a grant from the Tennessee Department of Health to the Metro Board of Health for the Healthy Start Home Visiting Program to identify and provide comprehensive services to improve outcomes for eligible families who are part of at-risk communities. Do I have a motion?
Move.
Second.
It's been moved and properly seconded. Mr. Sharp.
Thank you, Mr. Chairman. That's a home visiting program that we've had since the 90s. It focuses on families that are at risk for child abuse or neglect for the first 3 years of the child, and they visit them pretty regularly.
Any discussion, any questions?
How do you identify those families?
They have their ways. I'm not sure exactly what all the metrics are, but they don't pick them randomly. They're folks that have a history of, like,
So something has happened in the past to kind of flag them.
There's also an internal and external within public health as well as external. For instance, a referral could come from library services if they're providing care to a child there. So if they're providing services, they can always refer, any agency can refer to us, so we would include them.
Any additional discussion? All in favor?
Aye.
Ours 2021-1156 by Toombs, Taylor, and others accepts a grant from the U.S. Department of Housing and Urban Development to the Metro Social Services Commission to fund staffing of the Homeless Management Information System.
Move.
Second. It's been moved and properly seconded. Ms. Lacey, yes.
Yes, hello, I'm Abigail Dowell from the Metro Homeless Impact Division, standing in for Judith Tackett. And this is our annual grant that we received from HUD to help us operate the Homeless Management Information System, which is a required database to receive HUD funds for emergency housing solutions for people experiencing homelessness. It's a regular renewal. If there are any questions, I'm happy to answer.
Any questions, discussion? All in favor?
Aye.
Any opposed? Motion carries. Ours 2021-1157 by Toombs, Taylor, and Welsh approves an assignment and assumption grant agreement amendment from Safe Haven Family Shelter in the U.S. Department of Housing and Urban Development to the Metro Social Services Department of the Continuum of Care Coordinated Entry Grant for support services and administrative costs to strengthen and improve the effectiveness of the program.
Move.
It's been moved and properly seconded. Ms. Abigail?
Yes, this is another annual grant from HUD. Safe Haven has had it in the past because we didn't have the systems built up at the Homeless Impact Division, but we do now so that we can take that grant on from them, and it makes more sense in our space. This will actually be the second year for us with this grant. We are having to do this process again because HUD did automatic renewals this year because of COVID-19. So in the future, it will come directly to us.
And how long does the continuum of care last for the families? Because I know they only stay with you for so many weeks, and then they're in their own apartment. Is this continued services to support them after they're off into their own apartment, or?
So there are several different options for utilizing the Continuum of Care funds. The majority of the agencies who receive that funding to help house individuals experiencing homelessness utilize it for rapid rehousing. And I think that typically they utilize it for about 6 to 9 months for, as they do like a decreased rental amount. And then it can last up to 2 years depending on what's needed. And it also can provide services beyond the rental assistance if necessary. And during that time when they're being housed with this assistance, it is the job of the agency to help find that renewable income source or help get them onto vouchers, things like that.
Okay. So are most of the continuum of care services around housing or also counseling?
Primarily around housing. for HUD funds. They are primarily focused around housing services, but they do try to offer some funding to provide support services as well.
Okay, thank you.
Thank you. Any additional questions or discussion? All right, perfect. So we're moving properly seconded. All in favor?
Aye.
Approved, 6 in favor, 0 against. So we off to bills on second reading, BL 2021-872 by Stiles, Hurt, Sepulveda, Benedict, and Bradford. Requires masks be worn by all individuals in public spaces as further described herein. We have a motion.
Move.
Second.
It's been moved and properly seconded. We have the sponsor here, Ms. Stiles.
Thank you, Chair. So,
Excuse me, Councilmember Stiles.
oh, not necessary, but okay. So here we sit, it's 2 weeks later, our numbers are up. They're at your desk. When you get there, I did a little infographic regarding the data that has transpired in the last 2 weeks. Just to give you some data points, the percentage of new cases since 9/7 is 5.1% up. It was 118,920, it's now 124,991. Deaths since 9/7 are up 3.8%, from 1,005 up to 1,043. And number of confirmed cases since 9/7 is up 5%, from 109,401 to 114,840. And just yesterday, nationwide, we have surpassed the deaths that took place within the 1918 flu pandemic. And much like then, they realized masks worked. And again, we made the same mistakes they did. They stopped wearing masks quickly, their cases went up again. We did the exact same thing. I feel like we are on repeat in the worst way possible. We know that masks work, they mitigate the spread. This is not a question of vaccinations or masks. It's vaccinations and masks. They work. The individuals that don't want to get vaccinated, while they're figuring it out, we still need to be protected. People that are vaccinated are getting breakthrough cases. I know more people right now that have had breakthrough cases than I did last year when the virus had no mitigation. So I think if our health department is going to play politics, as they have been and would like to continue and allow our numbers to go up, we as a body legally are able to step in. And so I'm asking you to please support this indoor mask mandate. It is something that is being done in other cities. They've seen their case numbers come down. I know you all have seen your emails from physicians here in town and also constituents begging us for an indoor mask mandate. There's a group, it's 900 medical professionals, Protect My Care. So they met today. They sent us an email as well. These are all individuals working at Vanderbilt, working in our other hospitals. They are seeing this firsthand. The CDC is saying, if you're vaccinated or unvaccinated in areas of high transmission, you should be wearing a mask. So it's not very complicated. We've made it so. But I certainly hope that we can move forward and make the right decision. Thank you, Chair.
Thank you. Any discussion?
Go ahead.
Councilmember Welsh?
I appreciate very much what Councilmember Stiles has said, and I don't disagree with the fact that we know that masks are good mitigation systems. I am one that does not particularly think our first mandate was very effective. I felt like our enforcement was limited and very inconsistent. And I think that research backs me up that public health initiatives rarely are successful without some sort of enforcement mechanism. Because without enforcement, without consequences, there is no incentive for people to actually change their behavior. We have seen that now, how that works with vaccines. There is private businesses are using the threat of being unable to have to be vaccinated as a cost of doing business with them to force people into a different position to make the decision to get vaccinated. And it's working. They just announced this week that we are up to 60% vaccine rate here in Nashville. And that is a great stride from the last numbers that we heard. I think that what we need as a city is much more effective messaging. We need, the behavior of a population is going to change more if we start viewing this as a social behavior rather than a government policy. There is a difference between government policy and community buy-in. And our problem is we have never had community buy-in for any of these compliance measures. And that is really, really important. We need effective messaging. We need good role models who are modeling masking behavior and explaining why we need this. Right now, we have the mask mandate in metro buildings, we have the mask mandate in schools, and as I say, private businesses are using, not only with vaccines, but using the threat of doing business with them if you're not masked or vaccinated. We also need to know that the masks that people are actually using as masks will work. During our last mandate, people were wearing masks with valves in them that do nothing to stop the spread of COVID. They were wearing simple cloth masks. They were wearing masks incorrectly, coming down over your nose. These things make the mask less effective or perhaps even ineffective. So those are things that we need to consider. I really feel like we are asking people to listen to science and listen to scientific professionals about the course of action with COVID, including vaccines and masks. And it's not just vaccines and masks, it's also social distancing. And those are the three legs of the stool. And I think all of them need to be in place for us to really get this on top of that. But when we tell the public health department that we know better than them and we want a mask mandate, when the public health department is saying they don't feel like that is the best expenditure of our time and energy, I think we're undermining that message that people need to listen to the science. And I don't feel like we as a body should take that position. I think we need to change our approach and our tack and spend our time and energy and money and political capital changing the discussion and the argument, making it more of a matter of social compliance and social behavior, because I think that's more effective. And I think that will be more effective than having a mandate that, for all intents and purposes, is just on paper. For without enforcement, that's really what it is.
Councilman Pulley.
Sure. I got a couple of questions. I'd like to ask Commander Gilder, can you make a comparison on what the enforcement would be to this ordinance as compared to what the enforcement is from a health order from the health department, similar to what we got during the lockdown?
Sure. So when we had the health orders in place last year, and I guess early this year, because it was a health order, there is state law that supports the enforcement of a health order. And so what we're talking about here, if this bill passes, is an ordinance, which is a civil offense and is prosecuted via a metro citation. That's assuming you'll give me your information and comply. But I don't have the ability to make a physical arrest. It's not a criminal law violation. When it's a health order that's in place, there's a state law that actually makes it a criminal charge. And so the individuals that we were encountering who were just completely non-compliant, weren't going to accept a metro citation or ID themselves, or indicated that they were going to continue to not abide by the ordinance, we were able to use the state statute to make an arrest and resolve the situation that way. So there's a bit of distinction.
If this ordinance passes and you are charged with the responsibility for enforcing it, are you telling me the most you could do is issue a citation, and if they don't want to comply with it, there's really nothing you can do to make them?
That's correct. I could issue a metro citation, which is a civil offense. It's a $50 fine, and that's the extent of my authority to enforce that.
Okay. Thank you for that. I've got one other brief question for Mr. Sharp. During the last meeting, when we discussed this resolution that passed at our last meeting, you had mentioned some issue with the state of Tennessee regarding the health department. And my question relating to that is, I wanted clarity to what you said. Is that a part of the daily discussions that the health department and the health professionals have regarding mask dates, or is that just simply a fact that you brought to us for discussion purposes at that meeting?
It is not. Thanks for asking, Councilman Floyd. It is not part of the daily discussions. It was an additional factor to be considered, and that's all.
Okay, all right, just wanted that clarity. So, I have a statement I want to make, but I want to allow the questions to go ahead. Is that okay with you, Mr.
Yeah,
Chair?
sure, yeah.
You want me to go ahead? Okay. My position on this is wrapped around the fact that we have health professionals, very good health professionals, who are on top of this on a daily basis. We have excellent doctors. Dr. Jahangir, I have the highest respect for Dr. Jahangir and Dr. Wright. And they meet with health professionals daily to discuss all of these variables and the changing data to make these decisions. And they have the ability to issue a mask mandate if it's in the best interest and it's their decision to do it. And they're the ones who really have the data. I also want to tell you some of the data that I have that's a little bit conflicting to the sponsors. First of all, we all know that Tennessee's a bad state, nationally ranked in vaccination rates and all the other data related to COVID. But when you look at Nashville's, we're trending to we're very consistent with the national average. Our vaccination rate is 60%. That's the sixth best county. We are the sixth best county in new cases and disease rate. We've had tons of pop-up events for vaccinations. Our positivity rate is 14%, and that's 90th out of 95 counties, and that's where you want to be, is low. The latest data that I have over the last 2 weeks is our infection rate's down from 1.1 to 1.01. Our percent positive rate over the last 2 weeks has trended down from 15% to 12.7%. So I believe that's going downward. I also question, given the enforcement procedures that are in place for this, who are we going to get to comply with this? People who are vaccinated, or people who are stubbornly not going to wear masks anyway? Is that enforcement going to force them to do it? So, I'm just not sure the juice is worth the squeeze. So I'm going to have a hard time supporting this myself.
Councilman Hauser?
Yeah, I've got so many things swirling around. I'll try to make them make sense. One, I think the argument that we need to make this socially acceptable kind of falls flat at this point, because if that were alone were going to work, then everybody would be wearing masks and there'd be no argument. If one chooses to relish their being a jerk, they're celebrating that they are anti-whatever, social pressure is not going to change them. Only thing that's going to change them is something that is a penalty. Either they're not allowed to go into a business because that business has a mask-only policy, or they are going to be fined. It's going to take something like that for those who at this point have chosen not to do a socially acceptable thing. I feel that somehow we need to be able to give our police department, I don't know if there's this resolution or this bill is the way to do it, or if there's another methodology, the power to be able to enforce. Because I know the numbers that say those that live in Davidson County, our numbers may be down as far as our infection rates. Our numbers may be up regarding those that are vaccinated. But everybody that does business within Davidson County doesn't live here. So we can't just say that everybody that is within our borders is included in those numbers, because there are people that are doing business and are recreating in Davidson County that are not included in those numbers. So it's a little wonky to just take those numbers. And the only thing that we can see, I can't tell you if you've been vaccinated or not, but I can tell if you have a mask on or not. So that is kind of a visual that says we are protecting each other. And in lack of not having a vaccination passport, that's kind of the only way that we know we are being protected with others. So I think we need to consider all that when we look at this bill or this whole situation, and as we work through it as a body and as we work through it with our health department. Because I certainly respect our doctors and their opinions, but the arguments that I've heard recently seem to be focused more on either or. Either you're vaccinated or you wear a mask, and I say we need both. So I just wanted to bring those points up. Thank you.
Councilman Glover?
Well, I'm going to talk about the economics, because that's kind of the way you guys look at all the stats on the health and everything else. I look at the numbers. So when we did the mask mandate and other counties around us didn't, we had a decline in our sales tax revenue. Every county around us had an increase. Wilson County, as an example, had a 47% increase in their tax revenue base, simply because we shut down. Now, did our people stop going out to eat and stop doing this or that? No, they absolutely didn't. They went to Wilson County, they went to Sumner County, they went to Williamson County, they went to other counties where the mandates were not in place. What scares me right now is if we're looking at what's happening in the nation right now. I read an article this morning. Our cash balance for the United States of America, they can't give when we hit zero. It's going to be sometime in October because we have spent and spent and spent and spent. And we've done so much damage to the businesses here in Nashville with literally, because I chaired the Small Business Task Force. There's a lot of people I can't even talk to now because they're no longer in business. If we do this and other counties around us don't do this, people will shift, they'll go to other places. And so we have to look at the hotel industry, we have to look at the restaurant industry, we've got to look at each one of the industries. And if that business wants to put a mask mandate in place, they certainly can do that. And then I, as a consumer, have the choice of going in that business or not going in that business. But that's a choice I get to make. I have to agree with Councilman Pulley. If there's really nothing that you can sink your teeth into, then there's nothing there. But here's what will be there. We'll start losing, again, on the tourism and all the things. As our economy is finally starting to pick back up again, we're going to literally kick ourselves in the knee when we don't need to be doing that. So from my standpoint, I can't support this because I believe that it'll be far more damaging than it will be healthy for the economics of Nashville. And so that's where I'm coming from. Thank you, Chair.
Councilmember Hurt.
And where I'm coming from is if you're dead, you can't spend any money, whether you earn it, or you're spending it, or you're saving it, or you're giving it.
Absolutely correct.
So, we talk about numbers. How about the numbers that we are number one in the fastest growing? Number one of the best places to visit. Number one for bachelorette parties. We don't need to be the national average. We need to be the number one, showing people we're number one in healthcare. This is the healthcare capital, healthcare industry, and we have average numbers. I don't think those numbers are good when you look at it on there. I have 2 staff members who's had 4 people in the last week to pass away from COVID. Something has to give. Prevention is the best solution. Always. Not questioning the healthcare professionals and their expertise at all. Because initially, the first thing they said we needed to do was wear masks before they even came up with the vaccination. And I don't see why that doesn't continue as we move forward and things get worse. And I literally cannot believe that we're putting a price tag on a person's life. Just like the drug epidemic, when it hit your home, your house, and I believe COVID has gotten to that point that every family has felt the fatalities of COVID. We're not trying to tell the health experts what to do. We're just advocating to save lives. And I think that that is our responsibility as much as it is anything else that we advocate as a council member.
Councilmember Porterfield. Councilman House.
Thank you so very much, Chair, and I appreciate the robust conversation from everyone. Commander Gilder, I do have a question. When it was a mandate from the health department, you spoke about it being a criminal charge. Can you expound on what would happen when it was a criminal charge if someone was not wearing a mask?
So we took kind of a tiered approach to enforcement, right? Even back then in the height of the pandemic, when a lot of cities were had mask enforcement in place, we still tried to focus on education first. So we spent a lot of time trying to educate people, warn them, give them a chance to comply. If that didn't work, then the next step was to utilize the Metro ordinance that makes it a violation to not follow a health order. And again, civil infraction, $50 fine, so we tried to take steps. If the person was wholly uncompliant and that was not going to be effective, or they wouldn't identify themselves so that we could cite them, there is a state law that makes it a violation to not follow a health order. I don't have the TCA code committed to memory because it's not a standard one that we use every day, but I can get it to you if you need it. But we were utilizing that state statute in the event that we had to enforce an arrest for a violation of a mask mandate. And again, that was based on the fact that our health department had placed an order to require them. So that we wouldn't be able to utilize that in this particular situation.
Do you have, and I apologize not to put you on the spot, I'm sure you may not have this data readily available, but do you have any idea of about how many arrests you all actually had to make for mask violations?
I don't, unfortunately, have that data pulled for tonight, but I can tell you, I mean, we were out there running enforcement every Friday, Saturday, and Sunday, and it was not uncommon to make a couple arrests an evening.
Okay, so a couple of arrests, so it wasn't something that you all were seeing, it wasn't a massive amount of arrests you all were making, it was not, when you say a couple, it sounds like it wasn't a lot of arrests.
Yes, ma'am, and it was because we were utilizing it as a last resort. You know, if we could educate, which is primarily what we focused on, but you know, if that didn't work, then we took the tiered approach and we're going up. And I can get you some numbers, but you know, my recollection, and I don't remember at what point this was during the course of the pandemic. I think we started, you know, compliance gained and then waned. So those numbers may have fluctuated as well.
Is there anything that would stop you all from doing a tiered approach with the exception of an arrest to educate individuals that don't have on a mask, and then if they're not compliant, then follow up with the citation? So it's still a tiered approach. You just don't have the arrest at the end.
Well, we can always talk to people and educate people. The difference here is if with enforcement, the most I could do is issue a citation, and that's assuming that you will cooperate and provide me your information to write you a citation. So there is a bit of a distinction there.
And the reason why I bring that up is, in my opinion, the goal of a mask mandate and the goal of us having people to wear masks, we want them to be educated. We want them to know why they need to wear a mask. The goal should never be incarceration. The goal should never be putting someone in jail or prison because they're not wearing a mask, exposing them possibly more exposure to COVID, the financial implications of someone being arrested. So ideally, what we want to do is educational approach anyway. So I don't see that as being a deterrent from us passing this mask mandate. My question for Dr. Wright, in your opinion, and this is just a yes or no, because I'm not asking about vaccines, I'm simply asking about masks, will a mask mandate reduce transmission?
The actual answer to that is I'm not sure. Our numbers right now are stable and appear to have peaked, but I can't say.
Okay.
It would depend completely upon what the compliance is. The other thing you have to consider, a large percentage of the people that are, as you said, are from out of county, that are being hospitalized and everything else. And the two main places that we're seeing transmission right now are in the home. Mask mandate's not going to help that. And social gatherings, which frequently are in another person's home, and therefore, we're not going to see the mask mandate have an effect on those, unfortunately. So that's where we're seeing the main transmission at the moment. So based on that, that would be my answer. I'm not sure. It may, but I can't say for sure.
I would think, and I'm obviously no scientist, but I would think since the CDC says that on their website, it says that masks are required on planes, buses, trains, and other forms of public transportation when traveling. Since masks are required in some cases, I would believe that that would be an indication that science shows that wearing a mask helps reduce transmission. I believe, as Councilwoman Stiles has said, it's a both and not an either or. Even with high transmission rates in the home, you're absolutely right. It's not going to a mask mandate won't stop transmission in the home, but hopefully the mask mandate will stop the individual from getting COVID and then bringing it back into the home. It is very frustrating because I was a lean yes on this. I was barely supporting this mask mandate simply because of some of Council Members Welch's statements. I do think that it needs to be more education. I do think that we need to find other ways to do this. And ideally, this would have come from our administration and come from our public health department. But just in this room 2 weeks ago, what we heard was that there could be ramifications from the state. And we're saying we don't want to make this political, but that's making it political. And we are about the business of protecting our constituents. So with that, I'm going to support it, and I'm going to ask everyone to support it because we know that masks work. We know that when we are wearing them properly over our nose and our mouth, the mask that the CDC has recommended, not face shields, not one-layer masks, but when we wear these masks, we know that it reduces transmission. So we have to do everything we can in our power to make sure that we're protecting the constituents that we were voted in office to serve. So I'm supporting the mask mandate, and I will ask my colleagues to do the same. Thank you, Chair.
Councilmember Hauser.
I just wanted to ask Dr. Gill, if a mask mandate could have the teeth to be enforced, and there was no fear of retaliation from the state, would the health department be more inclined to issue a
So
mask
from the
mandate?
health department standpoint, I'm not opposed to the council deciding that that's what they need to do. I really am not. If that's what the council feels is the appropriate thing to do, I'm looking at the science and saying, yes, there are certain situations where we do have to mandate masks. In those areas, we've done that, we followed the CDC. In the case of asking us to put a mask mandate in place, that is, at this point, contradictory to everything we've done, which is to follow the science. And the science says, the masks are definitely helpful. Staying apart is definitely helpful. Getting vaccinated actually makes the biggest difference in spread inside the home, more so than even the exposure piece and the masks in schools. We're finding now that getting that number up further is reducing the spread. So anything you can do to help with vaccinations, great. Anything regarding masks, social distancing, they're all appropriate. But I don't know that they should be mandatory.
You mean like this social distancing?
Yeah, exactly like this, yes.
Exactly.
Gotcha.
So that's where we're at.
Councilman Roden, you have?
Just one quick question, if y'all could hit the highlights on the current CDC recommendations, what her bill ordinance is gonna do, and what our current state of recommendations are in NAS right now, just to, just kind of hit the highlights so we know where we are.
So the CDC would say that in situations where schools, for instance, there is no vaccination rate yet for a large percentage of the population, mitigation strategies are still very important. So masks in schools, which the schools have placed, is very important. Because of masks in schools, they have seen 20% reduction compared to other counties that don't potentially have mask mandates. So they're keeping kids in school, which is what we want to do. From the standpoint of the general population, the CDC recommends masks, but it doesn't say they should be mandatory. And there are some laws of unforeseen consequences that can occur. If I'm upset because you're telling me to wear a mask, you can be sure I'm not going to go get vaccinated, or at least probably not. So there's potential other things from a psychological thing that can play in. Not saying they will, but are considered. I think the final thing is, all we were doing was making you aware that the state has this little bit of a wild streak, and anything can happen. I don't think they'll really do anything, but I mean, we needed to at least make you aware. And we're not basing, day to day, I don't think about, oh, the state might do this, the state might do that. We continue to educate students. The state said we're not going to do that as far as high school students, trying to get them vaccinated. we're actually going out to the high schools during sporting events and other things to try and get those numbers up because they're very low compared to other population groups. So we're trying to approach that. And again, we're just going back to the science that we've always followed from the CDC. And so that's where we're at.
Any further discussion? Councilman Parker.
Thank you for the recognition, Chair, even though I'm not a member of this committee. So I just had sort of one hesitation about the bill, and that is that I think that the Metro Council as a body of part-time members that meets twice a month, this ordinance it's taken, it'll be 8 weeks since it was first introduced and was not able to be heard as a late filed thing, and then if it advances tonight, it will be up again in it's a little more than 8 weeks. So I'm a little bit concerned about our ability to be responsive to trends and data as a body. So I'm wondering if the sponsor would consider an amendment friendly that either set a date where we would certainly revisit this, say like sometime after the holidays, or perhaps periodic, like mandatory reexamination of the status of this, say the first meeting of each month moving forward, because as it's written, there's no end date or conditions that would end it. It would require sort of newly initiated action from the Metropolitan Council to end, as I read it. So I just wanted to ask the sponsor if that would be considered a friendly amendment, and if that would be considered a friendly amendment. That's all.
Councilman Stowe?
Thank you, Chair. So, I don't think that makes sense, just from the standpoint of if we're actually following science, we need to see that we're getting our cases per 100,000 down into a range that is, well, dare I say, acceptable. And setting a date without knowing how people are going to comply is foolish. Because if we decide that we're just gonna lift it on December 31st and our numbers are still high, why are we ending it? So I think the way it's set up right now, it's a resolution. If we have the data showing that our numbers are going down, then as we can come to the next council meeting with a resolution and we can end the mask mandate. And I think that makes the most sense because you cannot control the factors that are needed in order to set an end date.
Councilman Hurt?
So we were in a lockdown where we couldn't go out of our homes. And we found that wearing the mask was an alternative to help us open things up. So it's just bewildering to me to continue to debate this situation. But I had, and I'm sure all of you had a TV reporter ask for more content because we were bypassing the health experts with this resolution. And I don't consider us bypassing the health experts at all. I thought we were recommending, urging that we institute a mask mandate. Can someone explain why it would be thought that we were bypassing healthcare experts?
Councilman Stokes?
Thank you, Chair. So 2 weeks ago, we had a resolution where as council members, we were imploring the health department to actually follow the science and institute an indoor mask mandate. This is an ordinance which says the council will be putting the mask mandate in place versus the health department. So, and it's also in this version very clear to council member Welsh's point about what kind of mask you need to wear if you're wearing a mask, so that it's clear and not fuzzy as it was previously. And also CDC guidelines across the board, which I think we seem to be playing fast and loose with when we want to follow the CDC and when we want to just play political patty cake. But that is in essence
Well, I mean, I hear you, because I remember being at one of the COVID meetings with the mayor, and I actually did an illustration of appropriate masks that one would wear. And, you know, from the surgical mask or the N95 mask and the mask that, well, the so-called mask that people were using to pull up, you know, like a bandana. And so I think that the education about the masks has been pretty extensive over this past year. So I just think that we have to stand up and speak truth, and speak truth to power. And while we are saying that the state has nothing to do with it, it seems crystal clear that the state has everything to do with it. And I think the onus is on us to put the ball in their court. We don't stop the game just because they have a better team. And I think the Titans showed us that on Sunday.
Councilmember Glover.
Just very quickly, I think let's do address the question. The health department has in their power, if a mask mandate is needed right now, you could do it, could you not?
Yes.
And then the
And one of
police
the
department
things-
would have teeth to actually enforce, correct? All right. So we as a governmental body, a local governmental body, in my mind, are doing way overreach here. Now, obviously, what you think is right and what I think is right is two different things on this particular issue. Doesn't mean you're right, doesn't mean I'm wrong. Doesn't mean I'm right, doesn't mean you're wrong. We just have differing opinions on this, and that's okay. But I'm here to tell you right now, and I firmly believe this with all my heart. We talk about that we shouldn't put a price tag on life. I agree with that. But we also shouldn't hinder businesses from being able to do business in Davidson County. And if this passes, I assure you, it will hinder business from being able to do business. And so, unless y'all are ready to do another 34 to 37% property tax increase, I don't think the people of Nashville can accommodate those kind of numbers. Because it's been hard on people out there on economics, as you're all aware. And so I don't think that we need to be making it any rougher on them economically. And when the health department is not putting, because they have the state law behind them, that they could make it happen right now. And they're recommending we don't do this. So that's another reason I'm not going to be supporting it.
All right, Councilmember Porterfield, then Councilmember Welsh.
Thank you, Chair, and thank you, Councilmember Glover, for making that point. One quick thing that I would like to note is what we saw previously was a safer at home order, a stay at home order. We were asking people to stay at home. In this case, we're not asking people to stay home. People can still shop freely and spend their money. We're just asking them to wear a mask while they are shopping and spending their money. So I think that it's not an apples to apples comparison when we compare an actual shutdown versus asking individuals to wear a mask. And just circling back to the police not having teeth, until we have data that shows that there were numerous arrests, which I remember last year the conversation being that they were focusing on education and not arrests. So I don't believe there were a lot of arrests made, but we can get the data. So I will be interested in hearing that. But education is the key. And I think we've talked ourselves in circles. At this point, everyone knows how they're gonna vote. So I would implore us to go ahead and vote. It's 6:01, so, Chair, if we can.
Are you calling the question?
Call the question.
You can't do it.
Oh, I
Call
can
the question.
Thank you.
All right, so we're voting on the question, and I'll do this by voice vote. All in favor?
Aye.
Any against?
Nay.
So it's only one. So we will call the vote. So we are now voting on BL 2021-872 on second reading. Councilmember Hurt?
Aye.
Councilmember Glover?
No.
Councilmember Welsh?
No.
Councilmember Porterfield,
Aye.
Councilmember Hauser,
Aye.
and chair votes aye. 4 in favor, 2 against.
Thank you very much.
Meeting adjourned.